I'm Dr. Kent. I'm one of the allergists here at Allergy Asthma Associates. I want to talk to you about allergy immunotherapy. Allergy immunotherapy is a form of therapy which can help reduce the sensitivity of persons who have allergic disease. Immunotherapy, also known as allergy shots or specific immunotherapy, is a supplement to the management plan that has been set up for you by your doctors here at Allergy and Asthma Associates. It is used in addition to environmental control measures and medications which are necessary to help control the underlying disorder. Immunotherapy is often used when these measures fail to bring about sufficient benefit. Immunotherapy may prevent symptoms from occurring, prevent additional sensitizations from taking place, and also may reduce the risk of asthma from developing. It also may reduce the risk of existing asthma. It is the only therapy which can alter the natural history of allergic disease. Therefore, it's the only therapy that can change the underlying disease. Injections, it should be noted, will not help you with the symptoms at the time of the injection, but are part of a program to bring about long-term relief. Immunotherapy is a significant commitment of time and finances. Immunotherapy must be received routinely as scheduled without interruption to maximize benefit and to reduce the chance of allergic or adverse reactions. Immunotherapy is typically prescribed for 3 to 5 years, in some cases longer. Many patients do not see a benefit immediately, rather taking a few months to develop, with increasing improvement over the first 2 years of therapy. Immunotherapy starts with a dilute concentration of the allergen to which you're sensitive. In color-coded vials, we progressively increase the concentration of the allergen to the point where a dose which is known to be effective for the management of your disease has been achieved. In order to build through these doses, you would receive injections 1 or 2 times a week typically, gradually increasing the volume and proceed from one vial to the next. When you reach your maintenance dose, the interval between injections will then be increased, typically to monthly injections. Because you are receiving materials to which you are allergic, there is the risk of an allergic reaction occurring. There are 2 types of reactions. First, and more frequent, are local reactions. In this case, an irritation or swelling occurs at the injection site. Injections are given in the posterior aspect of the upper arm, in the softer tissues, and you can have some itching or swelling that occurs. This is treated according to the degree that it is bothering you with ice, antihistamines. Local reactions often occur in the course of immunotherapy, but rarely are a cause for discontinuing treatment. More significant would be generalized or severe systemic allergic reactions. This is a reaction that might involve generalized symptoms involving the skin, heart, lungs, or abdominal systems. Symptoms might include hiving, trouble breathing, difficulty swallowing, or loss of consciousness. All patients who receive immunotherapy must be monitored in a physician's office capable of treating allergic reactions for at least 30 minutes after the injection. If any systemic allergic reactions occur, after appropriate treatment is received, our office should be notified. Under no circumstances should an allergy injection be given at home or without proper physician supervision. To minimize the chance of a reaction, an antihistamine should be taken on the day of the injection. We do not administer allergy injections if you are feeling ill, have a fever, are overheated, or having uncontrolled symptoms of your asthma. Immunotherapy may be administered if you have asthma, however, asthma should not be currently symptomatic. If you are having asthma symptoms, proper medical treatment should be instituted, and once the asthma is controlled, injections may be resumed. For best results, you should receive your injections on schedule. If you are going to be away for any extended period of time, arrangements will need to be made to receive your immunotherapy elsewhere. Interruptions in therapy may cause a reduce in dose, causing you to take a step back and delay achieving the maintenance dose. More importantly, it may increase your chance of allergic or adverse reaction to the injection. Once you are receiving allergy shots monthly, you are expected to see your allergist on a regular basis, at least once a year if you have allergies, or more frequently if you also have asthma. These visits are important so that we can monitor the effectiveness of the injections and be sure that your underlying disease is being controlled. Please notify the nurse or physician if you are taking any new medicines while you're on immunotherapy, especially a class of medicines known as beta blockers. These are used in the treatment of high blood pressure, heart disease, and migraine headaches, for example. These medications may interfere with proper treatment of an allergic reaction should it occur. If you become pregnant while you're on immunotherapy, please notify our office. Immunotherapy may be continued safely during pregnancy, but dose adjustments are often required. If you have any questions after reviewing this video, please don't hesitate to ask. We would be more than happy to speak with you and answer any remaining questions. Thank you.